Canine Parvovirus, author Medina Regalia, LVT, at Tarleton State University. The reason I chose this illness to do my PowerPoint on is because it is a preventable disease that can have devastating effects on animals. I've also nursed many of these patients, and I am a strong advocate for vaccination to avoid this disease, and as well as educating the clients about the steps that they need to take to eliminate the virus from their environment if their pet should become infected. What is parvovirus? It is one of the most common causes of infectious enteritis in the canine. Without intervention, this illness can have a very grave prognosis. It's a disease primarily of young puppies, but other factors such as age, stress, genetics, and concurrent intestinal parasitism can influence the severity of this disease. So what exactly is parvovirus, and how does it replicate within the animal? This disease can only replicate in dividing cells or in the presence of a helper virus. A helper virus is a virus that allows otherwise deficient co-infecting viruses to replicate. In the case of parvovirus, examples of other helper viruses would be herpes virus or adenovirus. This explains their predilection for bone marrow, gut, and specifically the small intestine, as well as in the developing fetus. Transmission of parvoviruses is dependent on species. For example, in the case of felines, the transmission is primarily via the oronasal route, transplacentally, and occasionally vaginally via semen. However, in the case of dogs, they acquire the disease via oronasal and fecal-oral routes. Parvovirus can also be acquired from the environment via fomites. Due to its ability to persist in the environment and its resistance to many disinfectants, parvoviruses enjoy living in veterinary clinics and dog parks. Despite the limited routes of transmission, parvoviruses are easily transmitted due to their ability to persist in almost any environment. So who is susceptible to canine parvovirus? Puppies that are aged 6 weeks to 6 months are usually the most susceptible. However, there are a few breeds that do show higher incidences of the illness, such as Rottweilers, Dobermans, and American Staffordshire Terriers. Parvovirus is very stable in the environment. It can withstand a pH range of 3 to 8. It is also particularly heat resistant, with canine parvovirus requiring 1 hour at 80 degrees Celsius to be deactivated, and feline parvovirus requiring 2 hours at 80 degrees Celsius. Viruses within this family are also resistant to a wide range of disinfectants, but are susceptible to common bleach and aldehyde products. Despite this vulnerability to bleach and aldehydes, species within the Viridae family can withstand many disinfectants, and their ability to persist in the environment remains for at least 1 year. This disease is found globally, with higher incidences of contraction during the months of July through September. Symptoms of canine parvovirus may be sudden, which might lend the owner to think that their animal has been poisoned. Vomit for them is usually watery, foamy, or milky and slimy. The diarrhea is often bloody and has a telltale foul odor. The animal will also experience fever, lethargy, become severely dehydrated, causing thick, ropey saliva. Because of the disease, the villi in the intestine becomes blunted and they are unable to absorb nutrients that break down the barrier to the gut flora, leading to anorexia. Diagnosis of this disease involves a history and a full physical exam, and of course we're going to look at the symptoms. A definitive diagnosis, however, early in the course of the disease relies on the demonstration of the virus or viral antigen in the feces. Some possible tests include an ELISA SNAP test. It should be noted that there are false positives that can be possible with recent vaccination history. The animal could also undergo an antibody titer, a CBC, a biopsy, or in the worst case scenario, a necropsy of the lower and middle small intestines and the bone marrow. During the course of treatment, there are some additional tests that can be run to assess the animal's progress in the disease. They can have a serum chemistry, they can have a urinalysis, a fecal flotation, they could undergo a rapid immunochromatographic test, hemagglutination inhibition test, as well as a fluorescence antibody test. Canines that come down with parvovirus require a well-rounded and comprehensive care plan. First of all, they will be needing supportive care. That would include fluid therapy. Typically, crystalloids are the fluids of choice, with sometimes having potassium chloride added or dextrose. Also, antiemetics may be administered to alleviate some of the vomiting. Metoclopramide is also used, and NSAIDs can be used in well-hydrated patients. Nutrition should also be considered. Partial parenteral nutrition until the patient is going 24 hours without vomiting is usually indicated. Some of the medication options that we have for these patients in the form of antibiotics are ampicillin, amikacin, and gentamicin. If they have parasitism present, pyrantel pamoate may also be prescribed. There's also the use of CSFs, such as Nupogen or Amgen, sub-Q every 24 hours. In my own experience at my former clinic, we have had owners request that they vet their animals at home due to the extensive time and care and cost for treating this disease. In order to do this, we need to fully inform the owner how to give the antibiotics by mouth, administer sub-Q fluids as needed, and also manage the diet. They need to be informed that the animal needs to be on a bland, highly digestible food and have frequent small feedings. The animal should also have restricted activity as they're recovering from this illness. The key to preventing this disease is regular vaccination. It is the principal control measure. Puppies should be vaccinated beginning from 6 to 8 weeks with boosters every 3 to 4 weeks until they're 16 weeks of age. Revaccination of high-risk breeds should be done at 22 weeks, and animals should have a booster every year. Animals should be kept from dog parks or areas with a higher risk of contracting the illness until their vaccination series is complete. It should also be noted that within the kennels, because this is a very infectious disease, thorough cleaning and disinfection of the premises must be carried out to prevent a disease outbreak. When educating your clients about this illness, they should be made aware to avoid introducing new puppies for at least a year and informed on how to disinfect the environment with bleach. Because canine parvovirus can live for months on surfaces and up to a year in ground soil, disposal of all bedding, bowls, crates, as well as removing feces immediately from the yard and the environment will help keep the virus contained and limit the spread. Regular vaccination should also be encouraged, and they should also be informed if treated immediately. The infected animals do have an 80 to 90% survival rate, but they may suffer from permanent effects. When nursing our parvo patients, all animals that are suspected of having the parvovirus infection should be isolated until diagnosis is confirmed. All affected animals requiring intensive care should be kept clean and dry. All waste and bedding of infected animals should be disposed of directly from the isolation area. And all nursing staff should wear effective PPE, including booties, gloves, and while caring for these patients, and they should not wear these clothes into the rest of the clinic. These patients are very susceptible to secondary infections due to repeated sub-Q treatments, accumulation of wet surfaces, and around their catheter sites. You should also monitor puppies to ensure they are not overhydrated. Parvo is a very preventable illness in our canine patients. Infected or suspected infectious patients should all be isolated from other animals to prevent the spread. Owners need to be fully informed as to how to eradicate the bacteria from their indoor and outdoor spaces, as well as following proper vaccine protocol schedules. Long-term effects can occur in recovered patients, and the owner should be made aware of these health changes as they occur. And this treatment is often costly and require intense therapy. References used. Image references.